Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we will talk with Shelburne Stevens about Novant Health's COVID-19 vaccination efforts. Then we'll meet Dr. Richard Thompson of Novant Health OBGYN, who will share his personal commitment to receiving the COVID-19 vaccination. Next, we'll discuss childhood immunization with Dr. Lori Tackman of Novant Health Pediatrics, Brunswick. Finally, we'll learn about the new Da Vinci surgical robot with Dr. Max Beninati of Novant Health Surgical Associates. Stay tuned to learn about valuable health topics with HealthWatch. First, let's welcome Shelburne Stevens of Novant Health Brunswick Medical Center. Shelburne, thank you so much for coming on the show today. It's always so much fun to have you.
It's always good to be here with you, June.
And then we always laugh and we have a good time.
I know we can't see the smiles now.
I know, I hate that. But we're going to learn so much from you today because we have a very important topic. So, I know it's a very busy time at Novant Health. How's the team holding up with the pandemic?
They're doing well. It's been very busy. We've had high COVID numbers at the hospital, inpatient, a lot of testing in the clinics, and the volume has been high. But they're doing well. They're supporting each other. It's great teamwork. It's just been amazing to see them all come together to take care of the community and these really sick patients.
Yeah, it appears that way to me. They certainly are healthcare heroes.
They truly
at
are.
Novant Health. So over the past couple of months, there's been a lot of focus on gone into vaccinating team members and community members for COVID-19. So for today's interview, I really would like to share how the efforts to vaccinate began. So tell me about the day the first vaccine or the vaccination arrived at Novant Health Brunswick Medical Center. What was that day like?
It was a big, exciting day. Everyone was nervous, but they were excited. Some folks knew that they wanted the vaccine right away. Others wanted to see me get it before them or their peer before them. But when the truck finally arrived, we had a whole team that met them at the loading dock. People were cheering and clapping.
That's super.
And then we escorted the doses up to the pharmacy because we had Pfizer the first time, and so we had to have the super cold freezer, which we have at the hospital. So it was a very exciting day.
Yeah. Well, how did the team members react to that initial chance to be vaccinated against COVID-19?
Well, there were a lot.
Excited?
They were excited. They were a lot ready to roll up their sleeve and hold out their arm because it was just one step closer towards the end of this pandemic, and it was a relief to those who were taking it. There might be some level of protection because you got to remember, for months they have been doing this and going home and taking off their clothes in the garage and running straight to a shower, and their biggest fear was giving it to their families.
Yeah, and that's what we had Dr. Thompson on here, and he agreed that he was worried about his family and his patients and what have you. So. Well, shortly after that began, the state opened up the vaccination to 75 and over, and then the 65. So I understand that a partnership was put in place to help deal with all of this. Can you tell me a little bit about that partnership?
Yes, we, with the county health department and Dozier Memorial and Novant Health, we had a call to talk about there's a lot of people to be vaccinated. When we talked about 75 and over, that was around 15,000 people. But when they opened it up to 65 and over, that was pushing us up closer to 50,000 people. And just the manpower to still run our facilities and do this, we were going to have to do it together. So we came together and talked about just putting all the vaccines in a pile. We would send team members from each facility out there to work, and that's when the college joined us at BCC, and Dr. Smith was great to offer us Odell Williams and Virginia Williamson Event Center, and we plan to do it on the inside there. And we started there inside, and quickly learned we couldn't do as many people through that process as we could through a drive-through. And the county emergency management was phenomenal, drawing out this drive-through system with lanes, and it was color-coded, and how we would question people coming in, because some people could wait 15 minutes after their vaccine, some have to wait 30.
Right.
And we'd never done that as healthcare workers outdoors, and so we did it. We followed the county's instructions and came up with this really, really well-defined, well-organized drive-through process to vaccinate as many people as we could.
And I would reiterate that I've been working up there for the past few weeks, and it's amazing. It's like clockwork. It runs great, and I just can't say enough good about it. So tell me what you've seen, some of the first patients' reactions to the vaccine. What have you seen?
Oh, they're very excited. They've been eager to get an appointment, to get on the schedule. Right now is the limited number of vaccines that we're receiving, and that's throughout every state. And they're hoping to send us more, and we hope that they do. We'll open up more appointments. But when they come through, they are so excited. Again, just like our team members, that sense of relief that there's at least some protection in my body, and that we may get to the other side of this sooner versus later.
Well, it sounds like there's many partners and community volunteers as well. So tell me a little bit about their participation.
So yeah, we've had a lot of community members who've been vaccinated want to volunteer, and we've been sending them through the health department, and they've been sort of finding out what job duties they could do. If they were a licensed nurse still, we could use them for vaccines. And a lot of people come through and say, who all is this out here? Because we're all bundled up in jackets. And so we explain to them that there's Dozier employees, there's county employees, and Avant Health employees, and a lot of volunteers.
So tell me a little bit about team members who are working at the vaccination site. What have they had to say about their experiences? I know what mine has been. I'm curious what some of the others are.
It's been very rewarding. Especially I had a nurse from the hospital had gone out, and she had worked in an area where they did take care of COVID patients. And she told me it was a refresh day for her to actually see people say thank you, and they're so enthusiastic, and just wanting to thank everyone that's out there for, getting them the vaccines. And she said, I was recharged when I left that day, so I'm ready to go back. And so we've encouraged a lot of our inpatient nurses to try to give us some hours, and let's get them out there, because it is a feel-good day. There's so much positivity.
It gives you a new perspective.
It does.
Because everybody is so thankful, but just to be able to do one little thing for somebody else it's a great feeling for all of us. And it's really good to see the community come together in that way. I mean, I know that some of our viewers out there probably have some questions about it, and I'm wondering what kind of resources we have for viewers that aren't sure what's going on.
Well, they can always call Novant Health or the health department to get their questions answered. They can go to NovantHealth.org, Brunswick Vaccine. That's where they can sign up.
That's an easy one.
It is. You just one click and all the available appointments come up. But I would encourage people to keep checking it, because if they send us a larger amounts of vaccines, we're going to open up more appointments. The last thing we want to do is just open the floodgates and then we don't have vaccine. And so they can go there and check, but read up about the vaccine. Currently we have Pfizer and Moderna. There's others in production. They haven't been approved yet. But as those come about, our long-range plan is to get them to the clinics and our primary care offices so they can vaccinate like they do flu. But we've never been through a pandemic like this, and it is different. There is a lot of paperwork that the state requires that people fill out.
There is a lot of paperwork.
And they've got to wait once they get their vaccine, so we just ask for their patience, and they can fill out paperwork as they wait for that.
It's been great for me. I've enjoyed every minute of it. And if there's somebody out there who's concerned about getting the COVID-19 vaccine, do you have what would you suggest to them? How would you respond to them?
I would really tell them to do their part and take the vaccine. We're all in this together. For a year now, we have been staying at home, wearing masks, washing our hands repeatedly, ordering groceries online. This vaccine is going to put us to the next step of getting back to some normalcy. It doesn't hurt. A few people have had some chills or low-grade fever, but that's very few compared to most say, I didn't feel anything, I felt fine the next day. But that is how we're going to beat this pandemic and get eradicated from our community.
Well, my heartfelt thanks to you, to Novant Health, to Dozier, to the health department, and all the many volunteers who have been out there. Thank you all so much for what you're doing to keep the community healthy.
Thank you. It's been a great teamwork and community effort.
Now, let's welcome Dr. Richard Thompson of Novant Health OBGYN. Dr. Thompson, welcome to the show. It's so good to have you back.
Yeah, thank you for having me.
It's always fun when you're here. Well, I know most people out there have met you or know of you. So just remind me a little bit about where you went to school and maybe where you did your residency.
I am from Virginia. I grew up there. I went to medical school in VCOM, Virginia College of Osteopathic Medicine, which is affiliated with Virginia Tech, and then moved here to the Wilmington area, did residency in Wilmington at New Hanover Regional Medical Center, and then from there moved to Novant Health and started working in Bolivia.
Yeah, awesome. Well, tell me a little bit about your practice. It's Novant Health OBGYN, correct?
Correct, yes. We currently have 4 physicians, a midwife, and 2 nurse practitioners. We offer the full range of OBGYN care, everything from delivering babies to annual exams and surgical interventions for various different issues. And we have 4 different locations.
Yeah.
Our main office is in Bolivia. We also have satellite locations in Calabash, Southport, as well as Leland.
Yeah, that makes it really convenient for our patients.
Yeah, we try to offer multiple options.
Right. Well, today we wanted to talk to you about COVID-19 vaccination and your personal choice around the vaccination. I know that it had an effect on you, and you were recently vaccinated, correct?
Correct, yeah.
So what did it mean to you personally to get vaccinated?
Well, to me, the biggest thing was I felt like gave me a sense of protection for my family personally, as well as patients, out serving the public and patient care. We certainly don't want to act as a vector for spreading COVID, and receiving vaccination really helps limit that chance.
Yeah, you're around so many patients and babies and this and that, and your own babies.
Oh yeah, yep, for sure.
Yeah. Well, I've talked with some healthcare workers, and they say they felt like it was a really historic moment when they received the vaccine, and kind of even emotional about it, about that whole process. So how was that moment for you?
I would characterize it as a huge sense of relief, just to know that, again, going back to the safety aspect was huge for me, and also just knowing that we're on a path to getting the country back hopefully back to where we were, this time last year and a half ago.
Yeah, and really by getting vaccinated, you're participating in that process
Correct.
of getting back to whatever that new normal is.
Oh, yeah, most certainly.
Yeah. Did you have any hesitations or concerns personally about getting the vaccine?
I had concerns, but they weren't big. I mean, mine were mostly related to immediate effects after the vaccination, as far as, most people have heard about muscle soreness, fatigue, those sort of things. I had talked to several people who had actually participated in vaccine trials and were told that they received the vaccine during those trials, and they said their effects weren't that great. So I felt pretty comfortable moving forward.
So what would you say to viewers out there who might have some concerns about getting vaccinated when it's their turn? Would you be encouraging to them?
Oh yes, most definitely. I mean, my experience was fine with the vaccine. I didn't have any ill effects, not even immediate, no fevers.
Nothing?
No muscle aches, no fatigue, nothing of that nature.
You probably worked the next day.
Yeah, Yep.
Well, I know that you care for new moms every day, and I know it's got to be scary. It must be scary to be pregnant during these times. Are you recommending to expecting moms, what are you recommending to them to stay safe during COVID-19?
Well, we're recommending pretty much the same thing that is being recommended to the general public. Wear a mask, socially distance, keep your hands clean, try to avoid public interaction when you can. Those are the biggest things that we're recommending.
So pretty much it's the same whether you're pregnant or not. It's the same
Yep.
recommendations. I was thinking about expectant moms who are healthcare workers, and they have that option to take the vaccine. What would you recommend? Would you?
We are going right along with what the American College of OBGYN states, which is that pregnancy you shouldn't avoid receiving the vaccine because you're pregnant. If you choose to receive the vaccine and once your time comes to receive it, whatever group you fall in for that, for the vaccine, that you should receive it at that point.
Should take advantage of it. Yeah. Wow.
Yeah.
Is there anything else before we close that you'd like to add?
No, just everyone stay safe and
Great.
do everything you can to decrease the spread and keep yourself and your family safe.
Yeah. On a side note, are you taking new patients?
Oh yes, all the time.
Great, great. Good to hear that. All right.
Yep.
Well, thank you so much for being here. It was great to hear your story.
Yeah, thank you for having me.
You're welcome. Now let's welcome Dr. Lori Tackman of Novant Health Pediatrics Brunswick. Dr. Tackman, it's so good to have you back on the show today.
Thank you.
I
Good to
don't
be
get
back.
to see you often enough.
Yeah.
anymore. Well, most of our viewers have met you by now, but some of them may have missed the last show. So tell me where you went to school and where you did your residency.
Yeah, I'm originally from Michigan. Grew up in Ann Arbor, went to medical school at Michigan State University, and then I wanted to get a little bit warmer, but went to Indiana University, Riley Hospital for Children for my residency.
Nice.
Yep, and came to North Carolina in '99.
99. And you're with Novant Health Pediatrics Brunswick, correct?
Yes.
Well, tell me a little bit about your practice.
Yeah, we are a general pediatric practice. We see right after birth, newborn, until college age, about 21, 22.
Really?
Yes.
Well, today I wanted to talk to you about kids and immunizations. With all the talk about COVID-19 vaccine, and I know that they're not giving it to children yet,
Right.
but let's talk about basic immunizations and how important they are. So what's actually required for kids today?
Right. In North Carolina, they are required to have hepatitis B, the DTaP, Hib, polio, MMR, varicella, and Prevnar when they're little, as children, infants and children. Then as teenagers, they need the Tdap, and the new requirement is meningococcal.
Oh, man, that's a lot. I think you just had to have a smallpox vaccination.
Yeah.
Well, are there vaccinations that are optional for kids?
Yes. So those ones are recommended,
Those are
that they
recommended.
really need them. And then the recommended ones are the hepatitis A,
Okay.
yearly flu, of course.
Of course.
The HPV for teenagers, and rotavirus for infants.
Oh, I know, I heard of that one. So if parents are concerned about some of these childhood vaccinations, or they have questions, what do you tell parents? How do you make them feel better about that?
Well, first of all, don't go Googling everything, because you
Yeah,
need
that's
to
for sure.
look under the appropriate information.
Yeah.
The American Academy of Pediatrics, the CDC, of course, they have the best websites and will have the most accurate information. Of course, talk to the pediatrician, any concerns that you have. We provide information at each visit that they can read all about the vaccines and side effects and safety profile. But I mean, we've had vaccines around since the 1940s, and in the combination, they've done numerous safety studies, and that's where they need to find their information.
Well, they can't get into school without that first big list that you provided.
Absolutely.
So I guess unless you're going to homeschool,
Yeah.
but even then I would be leery of not vaccinating my child. Well, that's really good advice. And right now I would like to talk about COVID-19 vaccine.
Yes.
And I know it's not available for children, but when it becomes available, what advice would you have for children or for their parents?
Well, sign up as soon as they can if they'd like their child to get it. We're not really sure exactly how the rollout's going to be for children. Right now, they do actually have the Pfizer vaccine is for 16-year-old and up. The Moderna one's only for 18 and up. Both of them are currently doing trials right now. I think AstraZeneca's doing a trial with 5-year-old and up.
Wow.
Yeah, so as soon as that information comes out, the CDC and the American Academy of Pediatrics will review everything, see how it's going, see what it looks like, and then they'll provide their recommendations. And
then we'll go by those
and then we'll go by
recommendations.
there, yeah, and it'll be a state-by-state thing, so North Carolina has to review everything and decide what they want to do for our children.
Yeah. Are you encouraging parents to keep up with their well visits at this time?
Definitely, definitely. This is even more important to keep up with your well child checks and vaccinations, because we know we have vaccines, to protect from these usual childhood diseases, and we need to keep on it. I mean, you've seen the measles out there, and we just don't want that to come back and wreak havoc along with the COVID.
For sure. Yeah, that's for sure. How about masking for children? At what age should a child be masking?
So, ideally, at home you could always practice with your child, but 2 and younger, do not. Yeah, that's not a good idea. And just try to get your children used to it as you can. Try to find a comfortable mask for them, and try to make it a positive experience and make it fun.
Yeah.
So.
Well, great. Well, on a closing note, are you accepting new patients?
Absolutely, yes.
Great.
Yeah.
And can you tell our viewers how to contact you?
Yes. You can call 910-721-4400 or go online and look up Novant Health Pediatrics Brunswick, and you'll find us.
Great. Well, thanks so much for being with us today.
Thanks for having me.
Appreciate it.
Thank you.
Finally, let's welcome Dr. Max Beninati of Novant Health Surgical Associates. Dr. Beninati, thank you for coming in today.
Thank you for having me.
I know how busy you are, so I really appreciate your time, and it's always really, really good to have you. So quickly remind our viewers a little bit about your background and your education.
Right, so went to medical school in Lake Erie College of Osteopathic Medicine, residency over in New Jersey, across the bridge from Philadelphia at UMD&J. Traveled to Maryland for fellowship, where I did a minimally invasive fellowship there with a focus on foregut and hernia. And now I've been here for coming up on 6 years.
Wow, seems like yesterday.
Yeah.
I remember the day you started.
That's right.
So tell us a little bit about your practice. It's Novant Health Surgical Associates.
Right.
Tell me a little bit about that.
Right, so there are the 5 surgeons, 1 PA, so 6 providers. We're constantly growing, adding on services. It's really been amazing to see the growth and change, even within the short period of time that I've been there. We've got great staff taking care of the patients and us. We have the different offices, Carolina Shores, the Bolivia. I also go up to Leland. So we're really reaching out to the community and offering a lot of varieties from breast surgery to abdominal to just really the gamut of general surgery.
General surgery, yeah. So what are some of the most common surgeries that you do?
So oftentimes a surgical week might look like several gallbladders, hernias. This week I've had 3 hiatal hernias, which are a lot of what my fellowship was focusing in on, which is for reflux. It's not uncommon we get the appendix or the bowel perforation, so colon surgeries, things like that, the breast biopsies in the office, and today I saw a thyroid post-op patient, so pretty common to do a lot of the general surgery options.
Yeah. Well, I understand there's a new baby in town. We have a brand new Da Vinci robot at Novant Health Brunswick Medical Center, correct?
We do indeed.
It was a great day, huh?
Yes.
Tell me about the benefits of this new Da Vinci robot.
So we recently upgraded to the XI, received that, and just started working on it within the past 2 weeks. It is a newer platform than the SI that we recently had. The energy device is more advanced. The optics are better. The 3D vision that we get when we sit in the console is just amazing with the camera. The microscopic movements that we can do that remove the tremor. It's just, the technology is really from the future, basically. It's just amazing.
I can tell you're really excited about it.
Yes.
It's like a new toy.
Yeah. We consider it, so the big thing with the robot, people wonder, is a robot working on me? And it's the big thing with the robot is it's more than just, a toy. It's the instrument that I'm using to do the same surgery. So in my arsenal, it's just another instrument that I can pull out and use on a patient if it's appropriate. So it's been wonderful.
And the surgeon is calling all the shots.
Yep, every single step.
That's right. So what type of procedures would you use this particular Da Vinci robot for?
So it's a very capable platform. The way that we're able to bring it in over the patient, OB is able to use it, urology is able to use it. I do abdominal surgeries, hernias, gallbladders. My hiatal hernias it's been very useful for. So let me think. Those are my colon surgeries. Regardless of where I am in the abdomen, I can really angle it, reach anywhere that I need to be.
Tell me what your speech sounds like when you're talking to a patient and you're recommending a Da Vinci robot procedure.
Right. So in general, that's my, since I'm fellowship trained for the MIS, I generally offer people MIS surgeries when it's appropriate, and for the most part, that's the way people want to go with the small incisions. They want to come to me and have big surgeries done with small incisions, and oftentimes go home the same day. So what I'll do is say the way that I would recommend this happen is that we do the surgery with the tiny incisions, and oftentimes the tool I will use on this is the robot, and it's this machine that we're able to place over you. We connect, and then I sit about 6 feet away where I'm able to do the operation. Monitor you, the anesthesiologist is monitoring, the whole team is still around you.
There's a whole team around that table with the patient.
So we're still intimately involved in the care. It's not a microwave, set it, forget it thing.
So there's many benefits to it, but one of them is a shorter recovery period, correct?
Yep. So
and I would think patients would really like that. Are there any instances where you don't believe surgery using Da Vinci is the right way to go?
So anytime that laparoscopic or minimally invasive surgery is not indicated, same thing with the robot. It's just a matter of is it the right patient, the right tool for the right patient. Certain situations, it's just not feasible to do the little incisions, and you need a larger incision. Sometimes bowel perforations, if there's just a lot of contamination, it's not the right tool. So there are plenty of situations where I do not recommend it, just because in my experience and professional opinion, we need to do it a different way, and the patients often understand that.
Well, that makes sense. And on a side note, before we close, are you accepting new patients?
Absolutely, yes. Yep.
They can just call the office?
They can call the office. They can go through their primary doctor. There's several of us in the office that are happy to see people.
Great.
If they ask for Benenati, I'm the Italian, but we have a couple of Italians. So.
Okay. All right. Well, thanks, Dr. Benenati. I appreciate your coming.
Thank you. I appreciate being here.
Thank you for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit novonthealth.org for more information on Novant Health Brunswick Medical Center, our local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.